Good evening, everybody, and welcome to our live Chatting with the Superintendent event. Virtual, of course, kind of common for this day and age, isn't it? It is Wednesday, January 27th. I'm David Mustonen, Director of Communications for the Dearborn Public Schools. Welcome to all of you for stopping by and visiting with us for this next hour. We will be here till 6:30, and if we need to, we'll run over a little bit, but 5:30 to 6:30 should be enough time to run over a few things that are going on in the district, talk with the superintendent, answer some questions, and spend a little time with everybody here in the Dearborn community. We are live on Facebook, and we are also streaming live on our Dearborn Public Schools YouTube channel, so you can also tune in there as well if you would like. Take us wherever you want. That's the beauty of modern day technology, isn't it? So joining us today, as always, is our superintendent, Dr. Glenn Maleko. Glenn, thank you for being here today. We've been doing this for how long now, these chatting events with our parents and our community?
This is, I think, the 6th year that we've been doing them. Obviously, we've changed, and now we're doing Facebook because of the pandemic, but we have started, I think the year it was, the first one, I believe, was about a half year into my first year of superintendency, and it was just a way to reach out to parents and staff. So we've done them with staff as well that are specific to staff, and it's been received very positively. I think I've pretty much been to every building physically to run the chatting events. Obviously, because of the pandemic, we're doing it virtually responsibly right now to allow more viewers. But I do think that the way we've changed the system here, that even when we do decide to maybe go back to the buildings, we may still want to do some Facebook and other online that can reach out to the whole district. So again, it's just a way for the superintendent to hear directly from the community. Again, I'm doing it for staff as well. And we'd have a lot of students that would show up sometimes to the parent community session. So we've actually taken their opinions and listened to them. Somebody may suggest something. It doesn't mean we can always do exactly what they want, but we get to hear from them. And the other nice thing is I have my cabinet there as well. All the administrators that chime in, and they kind of hear as well. And so I know we have a lot of our executive cabinet members and cabinet members that are listening right now, so they can hear from the public. So we're not just limiting the board meetings, but we're allowing multiple forms of communication for our community.
Well, I think, like you said, that's important just to listen. Sometimes it's, you have to just sit back and listen and hear, what's going on out there. And like I said, lots of times we get some really, really good positive feedback. And even if the feedback isn't always positive, as long as it's constructive feedback, I think that's what's important, right, Glenn?
Yes, and sometimes there's things that we may not have been aware of, and so we also remind people, did you talk to the principal? Did you talk to the teacher? Whoever it may be. We do try to avoid individual circumstances with student. We say this isn't the forum. More general questions about the school. But yeah, it gives me, in a non-pandemic situation, as you're aware, I do many building visits, so I get to hear from the community when I'm out at community events or in the schools. But this is just another way to set up that time, and it's just, to let people know that we're listening. And it has helped us change some of the things we've done. And you know that because you're on cabinet. We've made certain decisions based on some of the feedback we've received.
Absolutely. So we're going to be here for about the next hour. And like you said, if people have individual kind of concerns about a student or something like that, we ask that you take that up with your building principal, as you mentioned, or teacher first, principal, and address that. But we do want to hear from you, and we do want to, hear your questions, and you'll have that opportunity to put those questions into the Facebook comments section. One of our crack members from the communications team is monitoring that and will feed us those questions as we go on here. And I guess we'd just like to get started, Glenn, and talk a little bit first about the current health condition here in Dearborn as it relates to COVID-19, where Dearborn is at, where it's been over these past 4 or 5 months, going back a little bit, looking at that positivity rate.
Yeah, and I don't have the graph in front of me, but we did present that at the the retreat on Saturday. But generally, throughout, Dearborn has had one of the highest infection rates, and Wayne County for that matter. So the trend had been going up, starting when the board officially approved a return to school plan on October 26th. We had a plan ready to roll. We were going to start moving with students phased in the month of November. And then all of a sudden, the COVID data started really rising. And the trend went all the way up to 15.99 right around Thanksgiving. It stayed up there pretty high, and then it started to go down a little to around 12.2. It then went up a little bit around the Christmas, New Year holiday, and now it's been trending down in a positive direction. So, we want to remind people to mask up, follow the rules. I'm also hearing things that 2 masks are even better than 1 right now to protect yourself and others.
Wow.
So I don't have an official study on that, but I'm hearing that from some of the, the federal CDC and whatnot. They've commented on that. But now it's trending in the right direction. And so we're at 7.8% positivity in Wayne County. And the 2 metrics that we use that the board approved on October 26th, and they've reaffirmed at every board meeting since then, including the retreat on Saturday, is the matrix from the Wayne County Health Department, and they stick with it. We are now in a level D. Level E is the highest concern area, the highest level of concern, and we had level E since the inception of that matrix back in October. This is the first time we've went down to level D. That does take into consideration the local community infection rate and infection trends, positivity rate as well. So it's multiple metrics of COVID that goes into it. And that matrix also will tell you, depending on the number of potential positive cases that you have. Oh, there, I see you have the graph. That's great. Depending on the number of positive cases that you have in the schools, then you would make decisions as to whether you're in person, virtual, or other kind of methods. And that's in the August legislation from the state that we must follow the guidance, or we must accept it. Right now, I guess from the health department, we don't absolutely have to follow it, but we need to consider it.
Yeah, so we saw that graph there, like you were mentioning, that really kind of shows how that positivity rate, and that positivity rate is a good measure of how the COVID-19 infection is spreading throughout the community as a whole, and that's for the entire county. And as you said, you could really see how it was kind of trending up there, in November, and now we're kind of seeing a downward trend, which is good news. But we have to keep those mitigation procedures going: the wearing the mask, the social distancing, washing hands, and all of those kinds of things. Glenn, you started to talk a little bit about the matrix that we follow and the metrics that we follow and the grid. I just want to take just a moment to kind of show everybody where all that information is right on our website. If you go to dearbornschools.org, there's our website right there. We have a special COVID-19 section, as you can see, and I'm going to click on that. When you go to the COVID-19 section, there's data there that relates to specifically to our schools, and you will be able to see that, yes, over the time period, we have had students and staff who have had COVID-19, but all of those cases have come from community spread, not from spread within our schools, which makes sense because we have not been in schools, but you can see all of that. But most importantly, you can see this information that you were pointing out, Glenn. Here is the community risk level. This is one of the matrix that the board is using to determine when we can kind of get back to in-person learning. You can see that Dearborn, along with several communities, are now ranked at a D, which is an improvement. They were at E, as you were pointing out, Glenn, and now we're at a D. And then you talked a little bit about the positivity rate in the county. And right here, you can click on this, and it will actually take you, we post this every week, This is the official report that we get from Wayne County. This is the report that our board uses to make that determination, to look for those two metrics that Glenn was talking about, the risk level and the positivity rate. And you can see right now, the positivity rate as of January 25th is at 7.8%, which, you know, we're looking for that 5%, but it is down, it is trending down, and that's good news. And that means that we're all doing our part here in our entire community and entire county to kind of curb that and mitigate that spread. Remember, this is a virus. We never said it was going to totally go away or totally be gone. Our efforts have always been from the beginning to mitigate the spread, to not overwhelm our health systems, to protect as many people as possible, and especially those who are most vulnerable to COVID-19. So all of this information is right there on our website on the COVID-19 link. And even down here, you can see there are 3 matrix that go into making up this community spread, and you can click on those and see what those are as well. We have also links to other information from Wayne County and also statewide data, and then a whole bunch of different COVID-19 resources, including this one, which, Glenn, you might want to talk a little bit about this. This was started way back in March, this emotional support hotline.
Yes, that was for, you know, those that families or individuals that may need support. Mr. Asali from the special ed department, but it's not just for special ed students. It's really under the social workers, psychologists, and it's a line that people can call into, and they can provide support and guidance in a confidential manner. And it's important, especially because, you know, we don't have students in schools right now. It's a way for them to get in contact with our specialists that can provide social emotional support and social emotional learning support.
That's great. That's a great resource, especially we know how important that is during this time. So let's kind of move forward, and so now we've established that there are some health matrix or metrics that we need to meet here in Dearborn before the board is going to say, you know, give us the green light to get back to school. Back in October, when those health indicators were established, the district also came up with a plan that would phase us back into learning. That plan has been in place and has been ready to go. And I think at Saturday's meeting, the board kind of reapproved that plan, as they have been doing since October. So let's talk a little bit now, Glenn. So let's say the district hits those health measures, those 2 guide points that we're looking at. Then what comes next? We know there's kind of a timeline that will get us back into face-to-face learning.
So let me just mention too, and you kind of hit on it before I answer the question, is that we have a very solid plan. And even when the plan was approved in October, that's all we were working on all summer. That's all we were working on prior to the in-person learning plan. You know, we had a large committee of over 100 that came together in the summer, and it's a solid plan. The board was very responsible. We had several meetings. That plan is still in place. That plan was approved in October and has been reaffirmed at every meeting. And since we've had even additional months, we've been able to tweak the plan to even improve it even more. Now, the only changes really are the timelines as far as the secondary and phase in. But basically what the board approved, and everyone has to understand, you know, we understand that the governor, CDC, you know, maybe other legislatures, other individuals are making recommendations for what they think, you know, maybe the president and others. But the reality is the Board of Education was given the authority by the Michigan legislature that was signed into law in August. And so the ultimate responsibility under the recommendations from administration, the board has the authority to make decisions of local school districts, and that has not been changed. So regardless of whatever anyone is recommending, they're just recommendations. They're not, it's not mandated as law. And our board has been very responsible. Our board has taken it very seriously. They spent a lot of time. There's a tremendous amount of information. They siphon through the information that we provide to them, and they listen to the community comments. We know that the community comments, there's division. I even see right now on, the Facebook, you can base the comments are different, and we're seeing it every month. So what we have to do is do what we think is right based on the local conditions, the health and safety of our students, the need for in-person instruction for our students, and the health and safety of our staff and our community. So those are all the decisions that weigh heavily on the board. Having said that, what was approved, just to reaffirm, and again, it goes back to October, but we've enhanced it. Right now, we're in level D, so that was one of the triggers under the matrix. So that metrics has been hit. If we hit the 5% positivity rate, then it'll trigger the opening. So we get the report every Tuesday. We'll know on a Tuesday. We would then open the schools for learning labs the following Monday. And we already had in-person learning labs going in September and October before we ended up shutting them down because of the high positivity rate. And so what ended up happening, what will happen after that is there'll be 2 weeks of we'll have 2 weeks where the students will be in learning labs in all schools. And again, that's not for every student, but some students we've already kind of addressed which students need to come. It may have been agreements with parents and otherwise. And then 2 weeks later, so positivity rate hits Tuesday, the following Monday, students can come back for learning labs. We do 2 weeks of learning labs that students can come in, and we'll continue online learning. And then we'll start phasing in-person instruction in a hybrid model that was presented on Saturday. And I won't go into the daytime, but you can watch the meeting. It's up on our YouTube. It basically is K2, 6th grade and 9th grade in week 1. Week 2 would be 3 to 5, 3rd through 5th grade, 7th grade and 10th grade. And the week and they'll also include preschool, GSRP. And the week after that, we'd be phasing in 11th and 12th grade. The reason for the phase in is obviously to limit traffic and to be, making sure that we don't have too many coming in at the same time. But basically, we'll be in 2 pods, meaning 2 groups. And generally, you'd be in group A or group B. Group A is Monday, Thursday. Group B is Tuesday, Friday, and then Wednesday is a day of pretty much online learning, or we call it asynchronous for elementary, depending on which level. It'll be some asynchronous and some checking in online learning as well.
There, and I just once again we have placed this timeline on our website along with the schedules for elementary, middle, and high school. It's on our website. On the main page there, there's a back to school plan link, and if you click on that back to school learning plan, you'll see that timeline right there that Dr. Maleko just kind of described. And we also have placed the schedules for elementary, middle, and high school as well. So you can see what that looks like depending on what group your student may be in. So definitely a lot of good information there, and I think that phased-in approach allows us to kind of get kids back and get students back, get our staff back, and allow parents that time to kind of get comfortable with how our new procedures are going to be. There's a lot of cleaning and procedures that are also part of this plan as well. Both in the classroom and in the schools and on our buses as well.
As far as the timeline goes too, I saw there were some questions. The timeline too, there was some discussion on Saturday of waiting 2 weeks to get the learning labs in. We limited that to just 1 week, meaning Tuesday we would know we would start the next Monday. There was a discussion by the board, do we start wait till Monday and then look for 2 weeks of 5%? We don't need to do that based on what they provided. So that's where that may have come. But if you go back and watch it on Saturday, I clarified that right at the end of the meeting as well.
Excellent. That's great. That's great. So there are some questions on this, and we'll jump back over to those questions as far as some questions about the schedule and how things will look. But before we get into that question part, I thought that it's probably important for us to touch just quickly on the other very popular topic right now of vaccines. It does provide a level of security or another layer that helps parents and students and staff feel more secure about returning to school. So I think it's important just to kind of give a little bit of a overview of how that looks for us in the district and how that's going to play out for our staff.
So we've been working hard on the vaccine situation. We talked about it on Saturday. That's all, since the governor made that educators are eligible. Now, it wasn't that first conference, but the reality is that she then came out the week after and said it's going to take several months to get educators vaccinated. So it wasn't like, you can line up on the 11th and everyone has a vaccine. We've been working hard. We don't have control over the vaccines. That's the bottom line. The district doesn't control it. We have to wait for the health department or other providers. And I'm just going to say it this way. There really was not a well thought out plan from the federal government. I'm just being honest. And the reason I can say that, we're hearing it, but I'm not getting political. I'm just telling you because all I've been doing is making calls about the vaccine to legislatures, to providers, and it seems like there's no consistent system. Everyone seems to be doing things differently, whether it's a certain county to a different county, the number that are being distributed. I will say too, I don't believe that Wayne County is getting the proper equitable number of doses compared to other counties across the state. So that's why I've been on the phone with legislatures and they're trying to help. So that's just the reality of the situation, and we have no control over that. So even though people are eligible, unless you have the vaccine doses, and David, you and I are in the meeting every Tuesday with the Wayne County Health Department, they're working hard. They got a process in place. So that's why we've also looked at other providers. Many of our teachers have gotten in through Henry Ford Hospital, Walgreens, and other places, other counties possibly, because again, they're doing things differently. And we have no control over that. We are advocating. The Wayne County superintendents are meeting together. And I think that I've had multiple phone calls going on. Appreciate the support of Representative Hammoud, Sylvia Santana, Debbie Dingle, Senator Peters, Senator Stabeno's office, Sam Baydoun, and others, Assad Turfy. These are the kind of calls we're making to try to get it for our teachers. On a positive, I would say this. I have data now showing that I have over 379 teachers that are not just teachers, but employees, because it's all K-12 employees that have received the vaccine. We have about 75% of our 2,700 employees that want the vaccine. Based on those that don't want it and those that have filled out our current survey where we had data that went out, and we've been over communicating with the staff. We probably need anywhere between 13 to 1,500 more individuals to get vaccinated in the initial stage. And then we would be comfortable saying that everyone who wanted the vaccine received it. So we're going to continue to work with many sources to try and find it. Ultimately, though, Wayne County is designated by the state as the group to determine who gets the vaccine and who goes first. And they have a formula they're working on. And so we're going to follow their guidance. And again, we've been working very hard. We are the third largest district in the state, so it does create, when other districts may only need 100 to 200 people, and we have 2,200 that really need the vaccine. We're dealing with larger numbers, and we know that the 65 plus category, we want all them to get vaccinated out in the community, and so we're going to continue to advocate, and we've been working very, very hard. So we do have some, and I think that's going to continue to grow. And I was on the phone today with Wayne County. So it is on people's minds, because if we get staff vaccinated, that would be another angle, a metrics that the board could reconsider to allow for safe return of students. Eventually, we want anybody in the United States who wants the vaccine to get vaccinated, but we know that we're hearing that could go into the summer or into the fall, to be honest. That's what I'm hearing on the news. So I know just as much as everyone else that hears it from the national news broadcasts.
Right, and I think
I would also say, Dave, too, that we're prepared. We have a committee in the district and you're on the committee. We have nurses, with the union heads. Everyone is working with us, and they're also helping. Board trustees are making calls. We have the city, Access, other groups that said they'd be willing to partner with us. But the one common thread is they don't have the doses. So once they get the doses, then we're ready to get the vaccine.
And I think that we just kind of need to follow what our healthcare providers have been, and the health officials have been saying to us, is that the vaccine is just one more mitigation step and process. So just as we're wearing masks, I'm not wearing mine because I'm by myself here, but just as we're wearing masks, we're social distancing, we're washing our hands, we're keeping down those the crowd, minimal crowd contact and things like that. The vaccine is part of that process, and so until we get everybody vaccinated, we have to continue those things. That's the message that we've been hearing, and I think that's the message that we're just going to need to continue with. We've been saying this, and I've kind of said it in a few meetings, is that, the new year started, and when the new year started, we always like to, hey, it's the new year, let's start fresh, and all those good things. And we definitely want that. We want that positive attitude. But just because the new year started, it doesn't mean that COVID's gone and it's done. We're still in this, and we still have some months to go yet, many months to go yet. And we are going to all have to keep working together to get through this. Glenn, you've heard me say this too many times, but I'm going to say it one more time. The governor has a great goal. She would like to have 50,000 shots a day being administered. I think that's an awesome goal. She also has the goal, there are 5.8 million eligible people in the state of Michigan who are eligible to receive the vaccine. There are 10 million people in the state, but 5.8 or 8, I'm sorry, 70% of that 10 million. Well, actually 70% of the eligible amount. So there's 8.6, and so she would like 70% of the 8.6, which is 5.6 million people need to be vaccinated. And if you did 50,000 a day, it would take almost 4 months to get that done. And we are nowhere close to getting 50,000 a day right now. Now we may, very soon, within the weeks and the months ahead. So right now, it's a supply and demand kind of thing. So I know we live in a very instant society. We order something on Amazon and it shows up the next day, and we like that. And it's just not going to be that way with these vaccines. It's going to take some time. And Glenn, I know how hard you are working to get those vaccines for our staff and to get that other layer of protection out there. So appreciate that. With that, I thought that this might be a good time, just a little over a half hour, to maybe get some of the questions that we had prior to getting on the air and maybe address some of those that are coming in. So what do you think?
Yeah, absolutely. Let's take the questions.
All righty. So one of the questions that came in is about learning labs, and they're asking if the learning labs can be longer. Previously, they were about 40 minutes one time a week, and they were, very limited in the number of students that we could bring in. So the question is, is there any way to make the learning labs longer, maybe more students, maybe more, have them more frequently throughout the week? Would that be something?
Those questions came up prior, David, and right now I think we're going to stick with the plan.
Okay.
They've been looked at and evaluated. Remember, too, we're only talking about 2 weeks that we're going to be doing them for to the phase-in. Having said that, if the data doesn't work out, we can definitely look at that and revisit it. But I can tell you that question did come up. Okay. And ultimately, a lot of administrators and teachers, they made the schedule and decided, because, you do have limits on the number that would go into a learning lab and then the time. So, scheduling purposes, you're balancing the need to get more students in with the amount of time, right?
Sure.
And so that's the give and take. So, I think our executive directors of student achievement were watching this, and I'll ask them to revisit that with the team.
And then kind of a follow-up question. Will parents be able to request which group their family is in if they need to be in specific groups for scheduling purposes? So maybe multiple children in the same school. Would they be able to, will we be kind of looking at that when we're scheduling kids in classes?
So it was important that the board approve 2 groups at the secondary level because now that allows for that possibility. We will do our best to accommodate all parents, and they will be trying to schedule that already between the families. If there's, I can't say it's going to be a perfect match with a district our size that we'll look into it, but our executive directors will work with the principals because they're going to be doing the scheduling, and so there'll just have to be some coordination between secondary, elementary, and middle school. And then, of course, looking at the numbers. I mean, that's the complication because we can't skew one group a larger number just due to that factor. So I do think it's possible, but there is the possibility, or it's probable that will happen, but there is the possibility in a few cases that it may not be. So we're going to do our best. We're going to do our best, as we always do, to keep the same families in A or in B.
And along those lines, you just mentioned keeping the numbers even, and so that the schools, because that's going to play a big factor in this, is how many, keeping the overall numbers in the school down. So someone was asking about, is there a possibility of doing 3 days a week of instruction as opposed to only 2 days a week?
The days were all looked at, and we decided that was approved. It was the board has already approved the 2-day plan. And the reason is, we had discussed in 1 week, could we do 3, and in other weeks, 2 rotating. So it would be 5 over 2 weeks. But one of the reasons we chose not to is because we're also using Wednesday as a deep clean of the buildings for extra safety. And then we're kind of getting all students together back online as well as a class. So we did look at that situation, but right now, that would not happen this year because the plan has been approved for 2 days. And our biggest concern was to try to get a plan that is solid, that maintains safety with getting students in person. So that was heavily discussed. So I do not anticipate any changes for this year.
Okay. We also started a pretty robust virtual learning program when all of this started. If students return face-to-face, will the VLP students, will they be able to remain in the VLP program, and will that program continue on?
Yes, absolutely. We made a commitment to them. We had 2 enrollment windows, which was in August, and we kept delaying it. When we kept delaying, it puts a lot of pressure on our staffing our size. Then we opened it up again in October for, I think, 2 to 3 weeks for people to sign up. But we did say they had to make a decision. The plan was put out there prior to them having to make a decision in early November. And, once they make a commitment, they're in that program, and we do not plan to remove them from that. In fact, we'll have a virtual learning program next year as well. We were planning for a virtual learning program prior to the pandemic. I know, Dave, you may have heard some of that in our conversations, but we knew that there was a certain group. It may have been a lot smaller. The pandemic, obviously, more now want it for safety. But we did have a certain group in the community that was actually asking for a virtual program. So we were actually we were planning ahead. And so that actually helped us when the pandemic hit because we were ready to roll with the virtual learning program. And that is an option. Now, we're not having another enrollment window. We are not able to do that. So whatever they chose by that last, and we made it very clear, we publicized it all over, and gave extra, but we just can't because of staffing. We can still work with individuals, and there are waiting lists if people want to try to, there's waiting lists. But I can just say right now, there's no guarantees, and we were pretty public about that, as was the board when we made those, approved the plan in October.
Great, excellent. So we had a couple of questions, and so I'm just going to read this one. It says, being a working mom, not me, these part days don't really work. How about full days for hybrid, like 2 or 3 days a week? The start and end times just vary way too much.
That was weighed. Those decisions were not only weighed by myself and administration, by the board, and we understand and we're empathetic to parents. Ultimately, though, we made the decision for health and safety and cleaning and ensuring that students would be safe to have a hybrid where it wouldn't be a full day. And those were decisions that were made. Everything's a tough decision, and we had to weigh that, the positives and the negatives of having a full day. What I would say is that it is a positive if we can get some students back into school. for in person. I want in person. We know in person learning is important. We also have to recognize that when we're in person, all the research on effective instruction means you're moving around the class, you're interacting with kids, you're in small groups. We're going to basically be not allowed to do that. The teacher's going to be from the center of the class at the desk, social distance. So the big thing here too is the social emotional learning for students too. And when I've met with my student advisory council at the high school, for example, and a lot of the emails I get from students is that they want to come into school and be with their friends. They want that normalcy, just like you and I get when we go into the office. It's healthy, right? And so that's part of it as well as to why we're going for in person. We understand it's a burden on parents. A lot of comments were made at board meetings. Board members are aware, and ultimately we balanced it with the health and safety and the needs given the fact that we're in a pandemic. But we appreciate, we understand the stress that it does cause. Unfortunately, we don't feel we're able to do that at this time, but hopefully this will be a short-term solution, and long-term we can get back to full days.
Great. So in our district, we do some testing. It's called WIDA testing. And basically this is, we have a high number of English language learners in the Dearborn Public Schools. About, I believe the number's about 10,000 of our students fall somewhere in there. And that testing is going on right now. So the question is, why are students and teachers returning to take the WIDA test if it is not safe for schools to open?
That is regulated by the federal government. The state has asked for an opt-out from the feds, but it was denied by the previous Secretary of Education. Michael Rice sent that up. It was denied. I don't know if the new secretary might allow for it, but it's a requirement. So it's not within the district's control. And we've articulated our viewpoints on that, but ultimately under the governor's plan, you are allowed to have students in for assessments. So that is allowed. Even when the governor closed the schools, when she closed all schools back in December, she still allowed for provision for testing and for certain ELL and special ed students and others. So for testing, it was never completely shut down.
I think too.
And remember, it's not like they're not in big groups too.
Right.
They would be individuals and there'd be social distancing. So it's not like a big group's coming in, because these are individualized tests.
Yeah, and that was the point I was going to make, and I think that's an important point to make, Glenn. I'm glad you brought it up. It's not like we're bringing 400 kids into the building. These are the kids are coming in very scheduled times, small very limited numbers at scheduled times.
Yes,
and with all the protocols in place, the safety protocols in place.
Yeah.
I think I know the answer to this. If we don't get to that 5% positivity rate, what will the district do?
We'll continue with our current method of instruction as we are. Now, whether or not the learning labs are a possibility, now the board always has a right to revisit it, and they have to revisit it every 30 days. So we're good for another 30 days based on their approval. And that's per the state law, but we would continue with their online learning as was approved by the board. And then we would also be, 1 second here. For example, if there's some other factors that come into play that, like let's say, for example, and I don't know, and one of the trustees, I think Trustee Petlichkoff said it on Saturday, what if all of a sudden the vaccines arrive and the doses are there? We don't anticipate it coming in the next 2 weeks. But let's say we have 75% of our staff vaccinated in 2 weeks. I don't see that happening, but then we would revisit, because it'd be another factor that we could consider. And so the board would have to meet and look at that if they were to choose to change the plan. But they reaffirmed the plan just this Saturday, so I don't anticipate any changes coming soon unless there are some factors that change. The one consistent thing about the pandemic we've been in is things continue to change. They just continue to change, so we all have to be flexible. And so that's why, that decision on a Tuesday might come because of the positivity, and all of a sudden we have the learning labs open on the Monday. So everyone's just got to be ready, including staff. Everyone has been aware of this plan since October, so just be aware that, those calls could be made that people are back in the buildings on a safer, social distance level.
And there's a question about when preschool will be back, and I think that is part of the timeline, the phased-in timeline to bring preschool back. I think they come back in week 3, if I'm not mistaken.
It's the week. So K2 comes back, and then it'll be the week after. It's with 3rd and 5th grade preschool will be in that group.
Okay. Also, what if staff is vaccinated and the students will, if we get the staff vaccinated, if the rates fall and all those kinds of things, we obviously we'll be getting more students back into the schools. We have a question here about athletics. We know there's a pause right now in athletics, winter sports. So the question is, Glenn, does the superintendent and athletic directors for the district support winter contact sports resuming prior to February 21st?
I've been consistent with following the guidelines by the state and the regulations for different reasons. I'm supportive of them coming back whenever we're allowed to bring them back. Whenever the Michigan Department of Health and Human Services or the state says we can bring them back under their guidelines, I want to see them back. My kids are in athletics as well, and they want to be back in athletics. We're a hockey family, and we're disappointed without hockey on a personal level, but we understand the sacrifices in the short term, and everyone has to make difficult decisions, just like we have had to. The state has had to make difficult decisions. I know there are a lot of people in our district that were disappointed, and myself possibly included, but I understand they've had to make decisions for a reason, and I support the decisions that are being made. If that changes and they decide that we're allowed to bring them back, we've been following that pretty strictly in our athletic department under Mr. Mashur, who advocates, and the athletic directors have been following that, and we've been adhering to every guideline and regulation that they put out. So I think we've been consistent with that, and we've allowed for the athletics throughout the year, even when we did not have students in school. And we were questioned about that, to be honest. Dave, you remember in the board meeting, and President Barry responded to it in October. Well, wait a minute. And we understand that, but we also know that it's voluntary and they're under certain regulations. So I'm going to follow the regulations in the rules, just like wearing the mask or social distancing. These are the rules that are put in place. These are the requirements. And so we will adhere to what the law is and what the requirements. But on a personal level, as a person, do I want kids to play sports? Yeah, absolutely. I think it's good to them. It's good for my own students. For my own children, but I understand, there's difficult decisions that have had to be made.
Okay. This next question, Glenn, I think you're going to have to pull out the crystal ball and gaze into the future. Are children going to be face-to-face full-time next fall?
I am hopeful of that. But I really can't say. I don't know what the conditions of the pandemic are going to be. I think the vaccine rollout will be one. We're hearing of new strands that are coming from the UK and other places that have one that has come into Michigan. So I really can't say. I hope we are. I'm optimistic. I'm going to plan for us to be back. But do I think it's going to be exactly the same? No, I don't. I think the masks and all of the social distancing and all the extra precautions are going to be in place regardless. I think those are all going to be in place. That's my prediction for a while anyway. But I guess that's where we're going to have to follow the science and the experts as to, what occurs as we go into the summer. And I think this vaccine rollout, we're hearing it. This is huge, right? So if we can get this out and get people vaccinated, then we protect people, then we have a much better chance. We all are tired of the pandemic. None of us want to be in this situation, myself included. This has been the toughest year for me individually as a person and as a professional, and superintendents across the state. It's been very difficult on all of us, and we're trying to do what we think is best, balancing those needs. There are a lot of opinions out there. I think the community just rest assured that I take the decisions they're very important. I don't take them lightly. and we understand the competing needs. But the reality is we're in a pandemic that only happens once every 100 years, I believe. We've never experienced this in our lifetimes, really. And so things are different right now. And so we want to be back. I hope we're back. I want to be back. I want to do my 420 school visits a year with students, but I don't know if I'm going to be able to or not, if it's going to be the responsible thing. So we'll have to wait and see as we move in. But I think there's a very good chance based on what I'm hearing with the vaccine.
Great. Kind of our last question, and then a couple of statements I'll read. Someone has a question about childcare and kids club, if that will be available during our blended learning sessions and during our hybrid learning, if those programs will be available.
To be honest, I'm not aware of them being available. We'd have to get, if you have the name of that individual, we'll have to get back to that person.
Okay, no problem. So just a couple comments. I'm take time to read those. Somebody commented saying the CDC says kids need to go back to school. We're aware of that. That study and that information was out last summer, the importance of kids being in school. I think Dr. Maleko has said repeatedly that the best place for a child to get an education is in a classroom in front of a professional teacher. So no argument with that, but as Dr. Maleko pointed out as well, we have to balance the safety and health of our students and our staff in making those very, very difficult decisions.
Well, if I can add something too, I mean, when some of these studies that are just coming out now, we're into February, it's very difficult to we've been planning for things and we know, but the reality is that all the information we've been given up until that point was positivity rates. It was looking at all this data for months and months and months, and states were then closing based on that data. And now all of a sudden we come into January and now we're getting, we're being told to use different it's almost like changing it, the data you're looking at. It's almost like, well, don't worry about that data now. Now there's studies out there and I get it, but it makes it difficult for school districts in the middle of the year when some of these things come out, and then, you got to react, then the expectation is to react to it when you're pretty much through half of your school year. If those kind of information or certain requirements like the matrix and other things had come out in the summer, or the legislation did, it would put us in a much better situation. In fairness to school districts across the state, the matrix that came out in October just came out at the end of October. And now, 2 months later, after the state was shut down, they're saying, oh, well, you don't really have to follow that kind of thing, even though it's in the law. So it puts us in a tough situation when we're trying. I'm data oriented. I have my PhD. I look at data. I want to be safe based on data. And so I give our board credit because they've continued to look at the data. They really have. And the metrics. And now we have to balance it with changing conditions. We understand that, like the vaccine or other things. And that's what we're doing. And that's what the Saturday conversation was about. We got to be realistic. It's difficult for everybody right now. And I feel for all the families that don't have their students in school. I want students in school. I want them in school safely.
Absolutely. Absolutely. And another kind of final comment here that came in, it said, please consider bringing back our seniors sooner than later.
Yeah, that was discussed again. We have to weigh decisions. Okay. There's positives and negatives. One of the reasons we decided to go with 6th and 9th grade is because we know our seniors have been in the schools. Now we know that from March, but the reality is we haven't had our 6th grades or our 9th grades who moved to the next grade in the building at all, unless they were possibly in a learning lab. So we made the decision that our seniors, and again, I get the argument. You can argue both ways, but we had to make a decision to phase in, and we had to make that determination. In fact, it came up, I believe, during the study session as a question, and we felt, and we made the decision, and I stand by it, that we needed to transition our 6th and 9th graders, and so we decided to phase them in sooner. And then even our 10th graders and our 7th graders, they were only in for like half a year last year, remember, too, until, maybe a little over half a year. So that's the other, whereas our 11th and 12th graders had been in the schools. So again, I get it. But with the 12th graders being a little more older and independent, that's kind of where that logic was within the decision. But I do recognize that there is also logic to the decision of bringing the 12th graders. Bottom line is we had to make a decision, and that's the decision we made.
Tough decisions being made throughout this entire year. In our last few minutes here, Glenn, I just wanted to touch on something that you kind of touched on a little bit earlier, and I just want to reinforce this as well. Back in the fall, we had some very stringent guidelines as far as reopening when it comes to cleaning. You had to clean touch surfaces every 4 hours. You had to go through and clean everything. Buses had to be wiped down in between all their runs. That was mandated. That was what you had to do in order to bring kids back. Now those guidelines have been loosened up quite a bit. Now it's you only have to wipe down twice a day. That magical 4-hour number seems to be less stringent and more just the practice of wiping down. I know that we have our plans in place at our schools as far as what we'll be doing with cleaning, and I just thought maybe we'd take a couple minutes here in our closing comments and our last few minutes to kind of just talk a little bit about what we know our schools will be doing as far as cleaning goes in the classroom, in the schools, and on the buses.
Yeah, we're not going to lower our standard. I mean, the state may have lowered some of the requirements as far as cleaning to make it easier for in-person instruction. But again, we stand on the health and safety as a primary condition. So if you heard us on Saturday, we are doing deep cleaning. We are doing the extra. We're not going to do the minimal standard. We have stocked up our PPE equipment and our supplies for cleaning, and it was hard to get a lot of it early on, but we were able to get a lot. We have a lot of it stockpiled in our warehouses that are going out to schools, and so basically and there's some videos, David, that you've put out that you can see on Facebook about actually what they did when they went into the classrooms and cleaned. We have these special devices that can go around and spray the classrooms. We have the extra, disinfecting products and things that are all safe. And so buses as well, they say you don't have to wipe down between, but we are going to. We made that decision as well, and that's why we had to consider the timing of busing and other things. So we're going to go above and beyond with the cleaning to ensure safety. And, our principals have met with our executive directors, and they toured schools. And basically, they have developed a plan that will show, how kids enter the buildings with arrows. And we talked about this on Saturday and where they're going to enter and exit. And we're going to just make sure that we go above and beyond to maintain the cleanliness in the building. The one thing we have an advantage too is we have an awesome, what we call an engineer program, where there's an operations head at every building. Most districts don't have that. And so that gives that individual, and they do great work working with our custodial staff, Mark Andrews and Gary Shelby in their department. And so that's our big advantage, because we invest in the physical operations of our staff. And some of the challenges we have in our buildings have to do with the age of our buildings. That's the reality. And so it creates, they're beautiful old buildings in a lot of cases, but it brings more challenges.
Absolutely. Well, thank you, Glenn. I appreciate that information. That's good to know. So just a couple minutes left here, and I'm going to give the floor to you to provide any final thoughts, comments, well wishes, encouragement to our district and to our parents. Thanks to all of them for sure.
Yeah, first, I just want to thank all the community. We're in a tough situation. None of us want to be in this. We need to stick together. And I know people are stressed out. It's hard on families. There's sacrifices going on. I see the light around the corner. There's some optimistic. Our staff have stepped up. I'm getting a lot of positive communications on how our staff are working with our students and how the online learning has really become a positive and improved. Of course, we prefer in person. We know in person is better. But having said that, we've totally enhanced our capability of technology. So when we are back in person, it's going to be an asset for our whole school community. Our teachers have stepped up, our administrators, our support staff, our kitchen staff, our custodians, our bus drivers have been working with Dr. Sweden and Mr. Saley to reach out to students that maybe weren't checking into classes and going door to door. They weren't going in the homes, but they were. I had two administrators, for example, at Etzel Ford that visited 100 homes to knock on doors and check in on students. We had buses going out in the community, so it's a whatever it takes in this, maintaining health and safety. We're now up over 100,000 meals a week we're distributing to the community. The PTA early on stepped in, and I know they had volunteers, so we appreciate them, the parents. We've been able to distribute Chromebooks and things, and we'll continue to enhance our operations. So I'm proud to be superintendent. The truth is, it's been a tough year for me. It's been a tough year for me personally and professionally, for all of us, but I will continue to ensure that the decisions we make are safe for our students, balancing the need for in-person learning. And I know with every decision that I make or the board makes, people aren't going to be happy, but we are going to be decisive in those decisions, and we're going to make those decisions because we are balancing the needs of the students with the needs of the health and safety of the community. And we'll look ourselves in the mirror every morning and say, we're doing what's right. And we've done some great things over this year as a team. Board of Education, I appreciate their support, their unwavering support during tough times. Wayne County Health Department, our entire staff, our union heads have been there as well. My administrative cabinet, to teachers that I've been in their Zoom classes, and they're doing amazing things, really. And to our students and our parents that have become teachers. We appreciate your understanding, and we thank you for, helping your children to help us. A lot of our staff are parents as well, like myself. And so we understand the stresses that it's creating on families right now. And, we hope to get out of this situation when I can't really see my dad or my in-laws because I'm worried about their health and safety too, as well. And I know a lot of people have made those sacrifices and those choices. And that's a choice that my family and I have made to protect their health and well-being. So, we thank everyone, and we really do have a great community here in Dearborn, and we have great people that come together.
Outstanding. Thank you very much, Glenn. Thank you very much for taking this time to share those thoughts, answer some questions, interact with our community. Appreciate that a lot. I know we are all very proud to be working here in the Dearborn Public Schools, being part of the team here, and knowing what an outstanding community Dearborn truly is. Thank you, everybody, for stopping by and visiting with us for this hour. We had some great questions, and we had some great comments as well. We'll get a answer for that question about the child care and the early learning, and we'll get that answer out. And we also want to just remind everybody that visit that website, the Dearborn Public Schools website. You can find that COVID-19 information on there. You can find the back-to-school plan on there. And if you follow the First Bell, which is our news and information website, we post information on there throughout the week, and it's timely, and it will keep you informed. We have a robust social media platforms as well, and they interact with Superintendent Maleko's social media platforms. So between all of us, we're trying to get as much information out there to the community as possible all the time. Thank you all for very, very much for joining us. Stay safe, be healthy, and remember, let's mask up, Dearborn.